So today we are discussing about general anatomy of lymphatic system. Lymphatic system is also a part of drainage system accessory to the venous system, and here the tissue fluid present at the arterial end of capillaries, it is drained by the veins. It is 70 to 80% it is drained by the veins, and the remaining 10 to 20% drained by the lymphatics. So the lymphatics starts as the blind tissue spaces, and together forms the lymphatic vessels. Small lymphatic vessels are formed and then into large lymphatic vessels. So lymphatic system, they drain the tissues 10 to 20% of the tissue space, which consists of large molecules. So lymphatic system is a drainage system of Coates type, and it is a drainage system of Coates type because it drains large particles. Okay, and lymphatic system, and here in the venous system, it drains the particles of fine type. So it is a drainage system of fine type. Venous system is a drainage system of fine type, and the lymphatic system is the drainage system of the Coates type. It drains the larger molecules, and here the venous system, it drains the smaller molecules. Here the lymphatic system starts as blind tissue spaces. They together forms the small lymph vessels, and together forms the large lymph vessels. Finally, the large lymphatic ducts, they finally opens into the venous, large veins. That finally opens into the large veins. And here on the left side we have large lymphatic duct, that is thoracic duct is present. And the right side we have right lymphatic duct, which drains the lymph from the right side of the body. And left side we have thoracic duct is present, which drains the lymph from the left side of the body. And here coming to the lymph vessels, these lymph vessels start as the blind tissue spaces, and together forms the small lymph vessels join, and together forms the large lymph vessels. And the lymph vessels, they open into the lymph nodes. These lymph vessels, they open into the lymph node. What is the function of lymph node? Is it filters the lymph. It is the lymph node and spleen. They are the peripheral lymphoid organ. Lymph node and spleen are the peripheral lymphoid organs, and what is the function of the lymph node? Is it filters the lymph. So, what is the function of lymph node? Is nothing but a peripheral lymphoid organ. What is the function of lymph node? Is it filters the lymph. So, the lymph vessels, the afferent lymph vessels, they enter into the cortex of the lymph node. So, we know that the lymph node is a bean-shaped node, consists of cortex and medulla here. So the lymph nodes are the bean-shaped nodes. They are the peripheral lymphoid organs. It consists of outer cortex and inner medulla. Here the lymph vessels, the afferent lymphatic lymph vessels, they open here. They open into the subcapsular sinus. Below the lymph node, it is covered by a capsule, and the afferent lymph vessels, it opens into the subcapsular sinus. Here in the lymph node consists of cortex and medulla, right? In the cortex, we have lymphocytes are present. In the cortex, we have lymphocytes are present in the cortex. So, these lymphocytes, they filter the lymph. These lymphocytes, they consist of both T and B lymphocytes are present, because the lymphocytes are of two types, right? T lymphocytes and B lymphocytes. Okay, so those are derived from the bone marrow. We call them as B lymphocytes, and those are derived from the thymus. We call them as T lymphocytes. Here in the lymph nodes, both T and B lymphocytes are present. So the B lymphocytes, they immediately act against the antibody by producing the antibodies, and these T lymphocytes, what happens is they alarm the macrophages and B lymphocytes to fight against the foreign organism. Okay, so both T and B lymphocytes, they are present in the cortex, and here the lymphocytes, they are arranged, the T and B lymphocytes, they are arranged in groups. We have outer zone has densely packed lymphocytes, and which are thickly stained, and inner we have a germinal center is there, and here we have lymphoblasts are there, and they further develop into lymphocytes. So in the lymph node, what happens is the T and B lymphocytes, they will get matured in the lymph nodes. So the T lymphocytes, they are produced from the thymus, and the B lymphocytes, they are produced from the bone marrow. Here the T and B lymphocytes, they get matured in the lymph node. Okay, and here through the afferent lymph vessels, the lymph, it opens into the afferent lymph vessel, and it is screened by all the foreign organisms. They are screened by all the lymphocytes present here, and here in the medulla also we have T and B lymphocytes, but here they, in the cortex, they are arranged in groups we call them as lymphatic follicles. In the medulla, the lymphocytes, they are arranged in cords. Okay, so the T and B lymphocytes present in the cortex and the medulla, they screen all the substances. They screen all the substances present in the afferent lymphatic vessels, and from there the lymph pass through. From there the lymphatic vessel arises from the lymph node. We call it as efferent lymphatic vessel. So it's the lymph node, it acts as an organ of filter. The lymph node acts as an organ of filter. Similarly, spleen also acts as an organ of filter. Spleen consists of white pulp and red pulp. White pulp consists of lymphatic follicles with and also arteries are also present in the white pulp. In the red pulp we have phagocytes, macrophages are present, cytosolids are present, T and B lymphocytes are present in the spleen. And spleen also filters the lymph. Lymph node also filters the lymph. In lymph node we have cortex and medulla are present. In the spleen we have red pulp and white pulp are present. These are the peripheral lymphoid organs which filters the lymph. And this, what are the central lymphoid organs? Central lymphoid organs are the bone marrow and thymus. Bone marrow and thymus. So those are lymphocytes which are produced from the bone marrow, we call them as B lymphocytes, and those developed from the thymus we call them as T lymphocytes. Okay, so that's about the lymph vessels, and the peripheral lymphoid organs are the this is spleen and the lymph node. Lymph node consists of cortex and medulla. It filters the lymph. And what happens is, during the infections, what happens is the lymph node gets swelled. Swelled lymph node we call it as inflammation of the lymph node. We call it as lymphocytes. That is called inflammation of the lymph node. Inflammation of the lymph node we call it as lymphocytes. And here the bone marrow and thymus produce lymphocytes, and these lymphocytes, they get matured. They get matured in the spleen as well as the lymph node. They get matured in the spleen as well as the lymph node. Okay. And so that's about the lymph vessels which are open into the spleen, which are open into the cortex of the lymph node, and efferent lymph vessels comes here, and we have various lymph nodes present in the axillary region, and we have cervical region, and we have jugular-digastric lymph nodes are there, submandibular lymph nodes are there. In the axillary lymph nodes are present here. These lymph nodes get swelled during fevers, because the activity of the lymph nodes gets increased during times of fevers, and any foreign organisms enters into the body, and so the activity of the lymph node increases. That's why the lymph nodes get swelled. So that's about the lymph node. And that's about, and bone marrow cells are pluripotent cells, and they give rise to lymphocytes, and the bone marrow cells, they also produce erythrocytes also. And thymus, it is an organ of huge entity. It is usually a bilobed structure. We know that the thymus developed from the third pharyngeal pouch. So, and this thymus, we can see the remnants of the thymus in the old day. We can see the remnant of the thymus in the puberty age. We can see the remnants of the thymus in the superior mediastinum. The thymus also consists of lymphatic follicles are present, and in the thymus we will be able to see the Husserl's carpels. In the thymus, when we take the section of thymus, in the thymus we will see the lymphocytes. They are arranged in thickly packed stains around the center, thickly packed and densely packed and thickly stained cells. And in the medulla of the thymus, we will be able to see lymphoblasts are present, and along with the lymphoblasts we have Husserl's corpuscles are present. They are nothing but the degenerated mass of epithelial cells surrounded by few epithelial cells are present in the thymus. So in the thymus, it is covered by a capsule, and each lobe, from the capsule, various septa divides the gland into more number of lobes and lobules. So what is the difference between the thymus and the lymph node is, here the entire lymph node divides into cortex and medulla, and here each follicle of the thymus divides into outer cortex and inner medulla. Here the entire divides into cortex, entire lymph node divides into cortex and medulla. Here each follicle, lymphatic follicle divides into outer cortex and inner medulla. So that's a thymus dependent lymphocyte and bone marrow. And then next is about the spleen and white pulp and red pulp of spleen. And we know that the macrophages and blood cells and also these are arranged in cords in the red pulp of spleen. We call them as splenic cords of Billroth. So the lymphatic system, it is a drainage system of Quer's type. It absorbs 10 to 20% of the tissue fluid and it starts as the blind places in the tissues and together forms the course. And here at regular intervals the lymph it is drained by lymph nodes. Okay, and these lymphocytes they are produced by the bone marrow as well as thymus. Usually the lymphatic ducts they drain into venous system. Here on the left side we have thoracic duct is there, on the right side we have right lymphatic duct is there, and here the lymphatics they are absent in brain. Here we can't see the lymphatics in the brain. So the brain is devoid of lymphatics. And one more thing is usually it is a colorless fluid. The lymph it is a colorless fluid. But in case of intestine the lymph is white color. The lymph is in white color. In case of intestine the lymph is in white color. We call them as chyle. Because of the presence of fat, the lymph is present in white color in the intestine. Usually the lymph it is odorless and also it is colorless. It is nothing but a transparent fluid. So lymphatic system is a drainage system of Quer's type, and finally it drains into the venous type only, and some organs are present here which are devoid of lymphoid system, which are devoid of lymphatics. Example is brain and also spleen. Spleen also it is also devoid of lymphatics. Okay, so that's about the general anatomy of the lymphatic system. And one more important thing is this lymph nodes they swell during infections. During infections these lymph nodes swell because what is the function of the lymph nodes? They filter the lymph. As they are filtering the lymph, they are trapping the microorganisms. So if these lymph nodes they get swell, that is an example, this is an indication for the infection. The swollen lymph nodes means this is an indication of the infection. Okay, so that's about the lymphatic system general anatomy.